If you do kill a few brain cells, they are going to regenerate. The brain is constantly making new connections, and some of those cells are being regenerated, so you'll be okay.
Welcome to VNA Today. I'm your host, David Miranda. Polycystic ovarian syndrome, or PCOS, affects millions of women in the United States and can cause symptoms including irregular menstrual cycles, infertility, and pelvic pain. Joining us today is VNA Healthcare Zaira Mondragon Meini with more information about treating the symptoms of PCOS.
Polycystic ovarian syndrome, or PCOS, is a hormone imbalance that affects women, and it's usually caused by insulin resistance and higher levels of androgens. Women with PCOS can have a variety of symptoms, including infertility, acne, excess hair, especially in places where women don't typically have hair, like in the face or chest, irregular periods, trouble losing weight. They can also have trouble getting pregnant. I think I may have mentioned that already. Women unfortunately can't cure PCOS, but there are ways you can treat some of the symptoms associated with it. There are different treatments you can use to treat the acne or the irregular periods. If you're trying to get pregnant, there's different treatments you can give to help you achieve pregnancy if that's something you're trying to do. And some of the long-term effects can sometimes be regulated with hormonal anti-contraceptives as well. Women with PCOS can seek treatment for infertility. There are certain medications that help resume ovulation. Lifestyle changes as well can sometimes help manage some of the symptoms associated with PCOS, and in some cases you might even need surgery. Some risks associated with PCOS include diabetes, gestational diabetes, heart disease, high blood pressure, stroke, and sleep apnea, and a lot of that's due to that insulin resistance. So we're not entirely sure what causes PCOS. We know that there are components of insulin resistance and high androgen levels. If you already have diseases that are attributed to insulin resistance, like diabetes, you might be at higher risk. If you think that you might have some of the symptoms of polycystic ovarian syndrome, it's important to come and seek medical attention. There are some tests we can do to confirm the diagnosis, and as mentioned before, there are some treatments that we can do to help with some of those symptoms associated with PCOS. To diagnose polycystic ovarian syndrome, a lot of times it's based on your medical history, your symptoms, how you're presenting in the clinic, but we do have lab tests that we can do to confirm the diagnosis as well. Here at the VNA, we can help with polycystic ovarian syndrome, as mentioned before, with helping in the diagnosis and also in some of the treatments to help alleviate some of the symptoms.
Thanks, Zaira. For more information about PCOS and the services offered by VNA Healthcare, call us at 630-884-4566 or visit us online at vnahealth.com. I'm your host, David Miranda, and see you next week.